right, everybody, we are going to get started, trusting that all the Zoom folks can hear me as well. And I want to thank everybody for joining us today for this amazing keynote lecture by Dr. Sacoby Wilson from the University of Maryland. And before I introduce him, I just want to note how important it is to ground all of the aspirations that we have with the new 5-year IBES strategic plan in the work and frameworks and frontier leadership that Dr. Wilson has brought to the area of environmental justice, environmental science, and health justice over decades of work. And when I reached out to him and said, would you please? And he wrote back and said, yes. I thought there's just no better exclamation mark for our strategic plan than to have somebody esteemed like him come and share with us today. So I want to thank Dr. Wilson for joining us today. And this is the first of 2 events that we'll have featuring Dr. Wilson and his work. Of course, this will also be recorded for those of you who could make it or your colleagues couldn't make it. But also the panel tomorrow at noon, we will be in UEL with Don King and Scott Frickel from our faculty, as well as a community partner from the George Wiley Center, to talk about what it means to be pushing the frontiers of environmental scholarship with community-engaged research and education. So I'm really excited for that conversation. Please join us for that as well. So I'm going to introduce Dr. Wilson and give him the floor, and then we'll hope to have some question and answers at the end. So Dr. Wilson is director of the E.J. Lab and Center for Community Engagement, Environmental Justice, and Health, and a professor at the University of Maryland Institute for Applied Environmental Health. He has 20 years of experience as environmental health scientist in the areas of exposure science, environmental justice, environmental health disparities, community-based participatory research, water quality analysis, air pollution studies, the built environment, industrial animal production, of course, with climate change as well, community resilience, and the broad area of how this all intersects with sustainability. He has some very notable accomplishments under his belt, and he advised me to keep this short, so I will hit only the highlights. Most notably, I think, he was the 2022 Sierra Club Robert Bullard Environmental Justice Award recipient, which is such a unique accomplishment. What a name to be permanently associated with. He also sits on the Science Advisory Board for the EPA, and he was involved in leadership with the 5th National Climate Assessment, and he's also the editor-in-chief for Environmental Justice. And I could go on and on. I feel so honored to be in his presence, as I'm sure you are today, and to learn from him and work together in accomplishing all of our most lofty goals in environmental justice. So thank you so much for joining us. I can't wait to hear your keynote.
Thank you. Excited to be here. This is my second keynote of the day. I did a keynote today at 9 o'clock for the Associate Schools of Public Health and Public Health Programs. So yeah, a little too busy, but excited to be here. I think it's my first time at Brown, so really interested in just learning more about what y'all are trying to do in the strategic plan. And hopefully my experience and expertise and just what I've been doing can be helpful as you build your program out. So we're going to talk about community-engaged scholarship. We're going to talk about environmental justice. But for me, when you think about environmental injustice, you have to talk about racism first. Racism is unfortunately baked into the walls of America. This is American as apple pie. You talk about the stolen lands of indigenous brothers and sisters and stolen bodies of, enslaved Africans. It's important to just ground ourselves in that history. And from a public health perspective, racism is a pandemic. We talk about COVID-19 as a pandemic. In my presentation this morning, I talked about the syndemic. We have a pandemic of racism, pandemic of environmental justice, pandemic of climate change, a pandemic of economic apartheid, and then we have a pandemic of COVID-19. So it's communities who are dealing with multiple stressors, multiple pandemics at one time. And so racism has to be something we talk about because it's embedded in how we zone, plan, and develop, right? It's embedded in our macro level policies. It's embedded in our environmental rules and regulations. Y'all know the book Color of Law. You can think about what happened in Flint. I did my postdoc in Michigan. The Flint water crisis wouldn't happen in Ann Arbor, okay? So you have to think about those issues. So you think about the history of the EJ movement. It was mentioned that I received the Dr. Bullard Award, Robert Bullard Award from Sierra Club. He's the father of the environmental justice movement. To me, the grandfather of the environmental justice movement is Dr. King. The great-grandfather is Du Bois. The grandmother, you have grandmothers too. Look at Dolly Burwell, the PCB landfill fight, right? You got other people. Vernice Miller-Travis would be one of those. She doesn't like me calling her icon, but I said it, Vernice, icon of the EJ movement. I see Vernice almost not every week, but see her a lot. But you think about Dr. King, when he was assassinated, right? His anniversary of assassination, is it coming up soon? He was assassinated in Memphis. He was working with the sanitation workers on this strike. And you saw how men were being treated less than equal, right? They've been, marginalized. You see the song that says, I am a man. And what they're saying is, recognized by humanity. When we think about communities impacted by environmental injustice, right? Where we live, where we work, where we play, where we pray, where we learn, right? Where people are overburdened by hazards due to race, ethnicity, class. They've been marginalized and disempowered. They've been dehumanized. So we're talking about communities who've been dehumanized. In many ways, communities who've been dehumanized, but also they've been commodified and decommodified, right? Because we use them to dump on them, but then they're not as valued. But their value is they've been otherized, right? They've been dehumanized. And so that's where you see the landfills. Whose communities host the landfills disproportionately? Whose communities host the power plants disproportionately? Whose communities host the refineries disproportionately? Whose communities host the industrial chicken farms or hog farms disproportionately? Pipelines, low-income communities, communities of color, immigrant communities whose voices are not being heard, communities who have been invisibilized by our policies, right? So when you think about the environmental justice movement, it is a social movement. In many ways, it's the child of the environmental movement and the civil rights movement. But you think about the human rights movement, it's a stream of the larger global human rights movement. And we think about injustices in general. Environmental injustice, I think, is one arm of the octopus of oppression. There's multiple arms of oppression, and so it's just one arm of that octopus, right? And there's something that I want y'all to think about when you want to address these issues. When you think about environmental justice issues, you have the traditional definition of environmental justice from the EPA. I call it the kumbaya definition because, or the all lives matter definition, just being bad. It's the fair treatment and meaningful involvement of all people, regardless of race, ethnicity, culture, when it comes to the implementation of laws and regulations. But we know that racism is there, right? We know that historic contemporary racism is there. We know that Jim Crow plays a role in this, Jim Crow 1.0 and Jim Crow 2.0. I, unfortunately, for family reasons, was in Mississippi for 2 weeks. I'm from Mississippi, and not for Jackson Water Crisis, but I actually was in Jackson, about 10 minutes away from the country club of Jackson that you've heard is trying to have its own water district, right? 10 minutes away. I drove by every day to address some family issues. But I bring it up because Mississippi is the epitome of what we're talking about. Mississippi is the epitome of racism. Mississippi is the epitome of apartheid. When you talk about apartheid in South Africa, where did it really start? Mississippi is still in the plantation mentality and how they treat people. Jackson, Mississippi is 80% black. They don't really have safe water. What happened in Flint? Look at places like Baltimore. And you see the same patterns, right? And so go back to the book Color of Law. Look at books by Mindy Fuller, Root Shock, about highways and byways. Look at books by about zoning and planning that's out there. Garbage Wars by David Pillow is another really important book. Look at books that talk about how the National Highway Defense Act was passed and how it was built through these highways and byways were built on purpose through communities of color. I was trying to remember Julie Z's book, Noxious New York. Like I had a little bit of brain, couldn't remember it. But look at Noxious New York, and think about the history of zoning in this country, right? And how zoning has been weaponized against folks of color and low-income folks. What's the first city in the country that had racism-based zoning? Anybody can shout it out. Anybody know? Racism-based zoning in the country? Got thrown out by the Supreme Court? It's in the state of Maryland. Baltimore. So you think about racism embedded in zoning and planning. Really important points there. I like the second definition better. It's a definition that was coined by Professor Emeritus Dr. Bunyan Bryant at the University of Michigan. And he talks about how you can realize your highest potential without experiencing the isms. And for those of you who may have a little bit of public health background, if you look at this definition, we're really talking about the social terms of health, right? We're talking about decent paying and safe jobs, quality schools and recreation, decent housing and adequate health care, democratic decision making. When you think about environmental justice, there's different types of justice, right? We're talking about procedural justice, getting back to the color of law. We're talking about distributional justice, making sure that you have a equal distribution of benefits when it comes to environmental goods. We're talking about reparative justice, right? Restorative justice, reparations. We also talk about intergenerational justice. So when you think about this definition, I like it better than the EPA's Kumbaya definition, which doesn't take into account context. It doesn't take into account racism. It doesn't take into account what people are experiencing every day. And you think about the history of the EJ movement. I mentioned Bernice Miller-Travis earlier. She was one of the authors of one of the first studies on environmental justice, toxic waste and race, 1987. Think about Dr. Bullard. One of his first books was Dumping in Dixie, talking about the PCB landfill fight in Warren County, right? And just the issues of who's impacted. Again, the voices that become voiceless in these processes, how NIMBYism and PIBYism, y'all all know what NIMBYism is, but do you know what PIBYism is? NIMBY is not in my backyard. PIBY is put in blacks' backyards. That's from Dr. Bullard, okay? So you think about those issues. When I think about environmental justice, I really think about three-legged stool, how some communities, you have the historic, traditional disproportionate burden of hazards, whether it be landfills, chemical plants, petrochemical operations, right? Whether it be highways, byways, chicken farms, hog farms, refineries, coal-fired power plants, gas-fired power plants, right? You also have those same communities have a high concentration of psychosocial stressors. Poverty, could be violence, could be racism, right? And in those communities may not have access to health-promoting infrastructure. One of the terms I like to use is salutogenesis. It was a term coined by Antonovsky in the 60s, I believe, and how they promote health, well-being, and wellness across all dimensions of the environment: built, natural, social, economic, political, and spiritual. So they don't have access to salutogenic infrastructure. So think about communities that are dealing with food apartheid. We talk about food deserts and food swamps. Those are symptoms. And actually, folks that live in the desert will be mad about you saying that the desert is a bad thing, or folks that live in swamps. So it's kind of negative. We got to be careful about the language, right? So the system is food apartheid. Or folks that don't have access to green space, right? A report came out about 4 years ago about the nature gap. Blacks have 3 times less access to nature compared to white counterparts. Low-wealth folks have 3 times less access to nature compared to their wealthier counterparts. And so what does it mean when we think about climate change, when we do mitigation? You don't have access to trees and green space, right? Trees are what the lungs of our communities. Trees are good for air pollution mitigation, heat mitigation, noise pollution mitigation, stormwater management, playability. You can have urban food forests. You can grow food, good for mental health. There's a lot of benefits. So not having access to that infrastructure, whether it be built or natural, is an EJ issue. And then, of course, when you're dealing with these issues, environmental injustice can lead to health disparities, okay? Whether it be asthma, think about lead. We always talk about, children and how we want to protect our kids. A question for everybody in the room and online: how are you going to put America first if you don't put your kids first? Why do we still have kids exposed to lead, right? Think about the caps on their potential of multiple generations of kids. So that's an important point to note when we think about environmental justice and public health, the connections. We failed on lead. We failed many children on lead. And we haven't done enough to really address the injustices associated with lead and the long-term health effects across multiple windows of exposure. Because it's not just when you're a child that you could be exposed and have health impacts, also in your adult life stage as well. So for me, from a science perspective, burden disparities lead to exposure disparities, lead to risk disparities, lead to health disparities. So when you think about the issues of environmental justice, you may have heard the terms cumulative impacts. So think about a community that's dealing with multiple stationary sources of pollution. So they've been exposed to chemical stressors. It could be lead, mercury, right? It could be particulate matter. They've been exposed to potentially non-chemical stressors. Say they have poor housing stock. So they could be exposed to lead again, but also be exposed to mold, mildew, and allergens. Think about the fact that COVID-19 and living in poor housing stock and what it means to exposure dynamics, right? They also could be exposed to physical stressors, heat pollution, right? Noise pollution, and then also psychosocial stressors. So folks who are dealing with environmental injustices are exposed to multiple chemical and non-chemical stressors through multiple media. So scientifically, it's very complex. There's a lot of intersectionality, and our science is not keeping up with their exposures. That's an important part of this science that we really have to evolve our science to really keep up with that. And race plays an important role in this, right? Some folks, due to their race, ethnicity, remember Dr. Bull likes to say complexion for protection, not my quote, his quote. Some folks have a pollution advantage, and some have a pollution disadvantage. So again, this is a syndemic. I mean, for communities who live near traffic, for example, and they're exposed to pollution from diesel buses or big trucks or commuter vehicles, they're exposed to particulate matters. That's one thing. You know, PM is like dust in the air. You know, PM 2.5 is 2.5 microns in diameter. It can get into your circulatory system, but these are things it can do to you. It can cause asthma attacks, elevate your blood pressure. It can contribute to diabetes, Alzheimer's. It can increase birth defects, rates of infant mortality, low birth weight babies. It can contribute to cancer. It can lead to premature mortality. It also can reduce life expectancy. That's one pollutant in the complex in the mixture that folks exposed to every day if they live near a highway. So when we drive our cars through somebody's neighborhoods, right, in their neighborhood, we're basically dumping poison, okay? We're poisoning people. And I don't want to make anybody feel bad, because I drove my car to the airport, but I'm aware of it. So what do we need to do to, again, repair those communities, repair those populations? That's something we have to think about. So what can we do? You know, we should be integrating, part of the reason why I'm here is, how are you integrating environmental justice into your strategic plan? Sometimes I'm very bad about EJ. I'm an EJ fundamentalist. Do you know the 17 principles of environmental justice? I'm saying, you don't know the 17 principles, how you doing environmental justice? Someone tell me, well, EJ could be anything. That's not true, y'all. I like for us to ground what we do in the 17 principles. Because again, it's a comprehensive framework, right? We're talking about protecting Mother Earth. We're talking about nature. We're talking about sustainability. We're talking about conservation. We're also talking about war. We're talking about not being for nuclear power. We're also talking about people speaking with their own voices. We're also talking about our indigenous brothers. We're also talking about protecting workers. It's a very holistic framework. They put a lot of work into that in 1991 at the first People of Color Summit, right? So to me, you have to be grounded. In EJ, you have to ground yourself in the 17 principles. And this is for those of you who are online and those of you in the room, you can see them. I'm not going to go through them all. These are not all of them, some select ones. But one of the principles that's really important, you hear a lot of communities speak with their own voice. So when I talked about different forms of justice, one I didn't mention is representative justice. We have to make sure community is speaking with their own voices. So when you're doing your strategic plan, how are you going to integrate community in the development of the strategic plan? How are you going to make sure the community is there to help implement the strategic plan? How do you make sure the community benefits from the implementation of the strategic plan? What are the metrics that you're going to use? And making sure those metrics are actually community informed. So the community must be engaged at all stages of the process. That sounds familiar, right? For those who do community-based statistical research, what is it? Communities are engaged in all stages of the process. That should be the same thing, the same principle that you follow, same ethos that you follow in your strategic planning process. So I like to talk about empowerment science briefly. And you like saying, is that spelled correctly? It is. I can spell. So I was told by one of my colleagues when I was on the board of Community Campus Partnership for Health, like Dr. Sacoby, you can't give me power. You can help me build the power I already have. So that stuck with me for over 10 years now. And basically, empowerment is about helping people connect to the power they already have and helping people build that power, right? Helping folks connect to the agency that they already have, okay? And so how do you build capacity, building literacy? So when you think about a lot of the new initiatives that come out of the federal government, many of you may be familiar with the EPA grants, the Thriving Communities Technical Assistance Centers, those are capacity building grants. So you may be familiar with the RFP, the EPA Grant Makers RFP. We are definitely applying for it because we are well positioned to, I'm not sure we're well positioned to get it. Universities are good at getting money. Are universities good at giving away money? I'm not sure about that, but that's a question for another day. I mean, just something, you gotta think about that. But I know a lot of universities will be applying for that. But those opportunities, my point of bringing them up is about building capacity and maintaining capacity and building power. And then liberation science. What is that? It's really about how do we liberate communities from being poisoned? How do we liberate communities from toxic trauma? How do we liberate communities from environmental slavery? You may not have heard it before. I have a paper published on it. This is one of my, in your postdoc years, you come with your like nice framework papers. I have like 3 or 4 really nice framework papers. Actually, I have a paper that talks about infectious disease and environmental justice. The SARS outbreak, and I mentioned at the keynote this morning, before COVID-19, it's like there's a whole new framework that you can apply to how you understand vulnerability for populations who are overburdened and making sure that they are prioritized when it comes to these outbreaks. No one read the paper, but I did mention it this morning, okay? I mentioned it this morning, it's been bad, but I don't think anybody read it. So when you think about liberation science, it's really about helping folks free them from pollution, from being poisoned, from environmental servitude, from environmental apartheid, from environmental slavery. So we have a lot of, you see these very strong words in this text, imperialistic, capitalistic, patriarchal, right? We do, it is what it is. This is speaking truth to power. Y'all talking about your new strategic plan. We have to change the culture of our science. I made a quip earlier about the funding. We have to do more science that actually serves people. Are we set up to do that? Serving communities, serving those who are vulnerable. Even that language is problematic, vulnerable, I know. Serving communities that may be under-resourced, that may be a better term. Serving communities who are trying to build their own power. And we actually have a special issue, just a plug, for the Journal of Environmental Justice, where we're accepting articles on liberation science. So it's really about approaches, methodologies, practices, visions for creating pathways for liberation from environmental racism, slavery, oppression, apartheid, and other systems of domination. Changing our science is important. This is a way to bring communities in to see real change. Exposure, justice, and equity. I was on the National Academy of Sciences Committee on exposure science in the 21st century, and it helped to develop the chapter on exposure justice. And it's really about my earlier point about how we're not doing a great job with exposure science and really capturing people's everyday exposures, and just how we need to focus on understanding these chemical and non-chemical stressors, understanding how some folks are maximally exposed, and really, again, bringing in community engagement and citizen science, even though citizen science is a term as one that's, critiqued harshly. And I've done it myself. Now, I'll speak to that. Now, my center is really about doing empowerment science and liberation science and advancing citizen science, but more trying to advance community science. I was on the board of the Citizen Science Association, no longer on the board member, not anything bad, just want to evolve that term a little bit. And also, I was on board of Community Campus Partnerships for Health. So for your work, when it comes to scholarship, you should be looking into those 2 organizations, Citizen Science Association and also Community Campus Partnerships for Health, okay? But my center is really about advancing these approaches. And when you think about community engagement, this is a continuum. As you move from left to right, trust increases, right? Communication increases, bidirectionality increases, impact and change increases. So you have outreach is really one directional. You may have a meeting, you give information out, but they don't really give you anything back, right? The community doesn't. You have consultation, it becomes more bidirectional. You may have a community advisory board, you have involvement, but to the farthest, the 2 last panels are the ones we should focus on, participatory and community driven. To me, community driven is the gold standard, but many of us, we should really be trying to focus on community-based specific research as a start. But for me, when you want to have good partnerships with communities, you have to have good relationships. But what are the ingredients of good relationships? You got to have trust, right? You got to have good communication. Think about the good relationships you have. What are all the ingredients? And think about the bad relationships you have. You have the opposite of those things. I can't talk to him. Can't talk to that person. They get on my nerves. I don't want to be around them. It's the same thing applies, right? The building blocks of good partnerships, of good relationships. You got to have some Aretha Franklin. Respect. Y'all get that? Trust, respect, communication, openness. Same things we need, one-on-one with each other. You need to also have those things when you're working with communities, okay? And so we have to support community science. We have to move from this Western science. We have to move from this colonial scientific practice where we extract, right? I got a question today during the other keynote, and they asked, what do we do when we have students? There's not anything saying anything bad about students. When our students go into communities and they collect data, but the community doesn't benefit. How do we address that? Y'all have to be aware of that too with your strategic plan. Not just doing a project, whether it's qualitative, quantitative. What are you leaving behind? What tool, right? How are you doing something to advance their agenda? And so that's going to be important. So supporting community science, supporting community and cultural knowledge systems. You know, one of the things I like to say is, for those who know Bayes' theorem or Bayesian terms, you know, in our work, in my work, I have general knowledge. I know I do a lot of projects, as Dr. Cobb mentioned, do a lot of stuff, right? But the community members, they have what we call specificatory knowledge, right? They're dealing with it every day. They know the issues. They experience it every day. That's actual data, right? They are scientists. Just because folks may not have a PhD, does that mean they're not a scientist? Let me just whisper to y'all. You don't have to have a PhD to be a scientist. Many of y'all were scientists when you were 5. I want to be a paleontologist. I still like Jurassic Park. I'm not a big fan. But as a kid, love me some dinosaurs now. Love me some dinosaurs. But we all love science, right? It's the scientific method. You don't have to have a PhD. So this credential versus non-credential is part of the problem too. Changing the culture. So how are you bringing in those experts who don't have a PhD, but they have the street PhD, they have the community PhD, right? Bring them into this work. That's important. And value and respect their knowledge. Build bridges, right? So we want to be able to do that. I think my slide got cut off a little bit. And then you think about CBPR, as I said earlier, communities are engaged in all stages of the research process, developing the questions, the research design, right? The research methodology, data collection, also analysis when you can. Sometimes it may be difficult to do that. Dissemination and translation to action. So community is, you recognize the community as a unit of identity. You recognize the strengths and assets in the communities. Again, you want to build trust. You focus on dissemination. You focus on action. Community members are not subjects. And then there's some terms that I try to get away from. I don't use the term subjects. I use it in this context. The term minority, too. I'm doing EJ work, right? And I talk to somebody, we got to do more to help minorities. That's a disempowering term. It's an otherizing term. Let's not use that term. We got to do a better job of language justice is another part of this. Language access, but language justice, showing care, sensitivity, and empathy for those who we're working with. So when you think about, partnerships, what are the quality processes that we need to have? Again, relationships. What are the meaningful outcomes? It's just not enough to have a great MOU and have a community advisory board, and you meet monthly, right? And you're following CPPR principles. But then what do they get? Did you improve the air quality, water quality, soil quality? Did you increase access to food? Did you increase access to housing, right? Did you reduce disparities? Did you produce jobs? Did you do workforce development, right? Did you build capacity in the schools? Do you have more young folks out there doing the work? That's what folks want. That's the so what. Okay? You got to get to those outcomes. And then you think about the social service of health, from a systems approach, how are you changing the systems with your work? And the subsystems. Because community-based research, this community-based research that we do, can change systems. How can we build healthy ecosystems with this work? How can we build salutogenic ecosystems with this work? That has to be part of your strategic plan, those outcomes. Transformation. How are you being transformed as an individual? In the EJ movement, you may not come from an EJ community, but how can you be a good ally? How can this university be a good ally? How can IBES be a good ally? What does that look like? How can we transform our institutions, the cultures? For those of you who may be junior faculty or postdocs in this room and you want to do this work, you got to say, hey, Brown, do y'all have community engaged metrics in your team promotion guidelines? Because if not, that's a problem. I see a head shaking no. Let me tell y'all, I made a joke at the keynote this morning as part of the discussion. Someone asked, a PhD student asked that question. I said, you know what? Give me a therapy couch. I can spend 2 or 3 hours sharing my experiences when half of me wasn't counted during the team promotion process. And I also shared, and this is as a note, CCPH back in 2007 to 2009 actually developed a toolkit for community engaged metrics in the team promotion process. So y'all can go look at that. It's kind of dated now, but it's out there. Multiple universities like UNC Charlotte and others have adopted those guidelines, but we're gonna do this work. We're gonna value the communities. We gotta value the faculty, the postdocs, the students who are also doing the work, and you have to have it written down. It cannot be assumed. You know what assume happens, you know. Don't assume anything. It has to be written into the tenure and promotion guidelines. You have to have an office of community engagement on your campus that helps organize this work. You have to make sure there's incentives for students. You have to make sure the trajectory set up folks for success. I've been there. I've done that. My experience was terrible when it came to tenure promotion because half of me was not counted. I had to pull my package, because supposedly when there's a whole little story, I have a therapy couch, pull my package because I went up early in year 4, 3 weeks before the vote. It wasn't just about that, but I had 55 papers published, $10 million in funding, some other stuff. And it was some other stuff. But again, if they had fully counted all of what I brought to the table, that wouldn't have happened. Now, I am tenured now, I'm promoted, I'm a full professor, but it's been a rough journey. And again, the point is, set folks up for success. You have to modify your tenure and promotion guidelines across the campus. You gotta make sure practice, apply research, community-engaged research is embedded in that, and then at the school level and at the institute level, you gotta have those guidelines in place. So you wanna have community transformation. How do you build community, transform communities? And also political transformation. Environmental justice, political justice. There's a whole political ecology, aspect of this. So you have to think about that as well. So again, so I'll always talk about Ernest Boyer. Y'all may not know him. The 5 dimensions of science, the science of inquiry. In academia, that's the one with the knowledge production. We got to produce more data. We got to learn more. We got to learn more. How much data do you need to get before you do something? It becomes extractive, y'all. It becomes colonial. Racial capitalism, whatever term you want to use, helicopter, this is in public health. There was an article that came out 2 years ago about health equity tourism. That's one thing you can look up. But this extractive science, I like to call it this pain pimping science, or as one of my mentors, Omega Wilson with the Western Revitalization calls it, he calls it, we're tired of being guinea pigs, Dr. Wilson. We're tired of guinea pig science. Scholarship integration, multidisciplinarity. If the mountain is the problem, my little pickaxe in environmental health is not enough. You have to take a prismatic approach to address that problem. We need multiple disciplines. The science of teaching, the science of engagement, and the science of application. How do you apply to solve the problem? I tell my colleagues and my students, if you don't do all 5 dimensions, sorry, you're doing incomplete science. Now you can say, Dr. Wilson, I wasn't trained to. That's not my orientation. I understand that. But I come from a community where I live near a highway. I live near a sewage treatment plant. And my mom would say, son, don't forget the landfill. Yeah, I live near a landfill too. People are living in these contexts. They're not looking for folks to just study the problem. They're looking for action, solutions, justice, okay? So you need to be doing all 5 dimensions. That has to be integrated into your strategic plan as well. And then valuing that. So I'm gonna skip this health equity tourism, I mentioned it, but it's more of a public health thing, but it's an issue of this extractive science, this helicopter science. So engagement bridges, what are the issues that are important to the community? What are the impacts of those issues, okay? And then what's your why? You can say, well, Dr. Wilson, you kind of scared me with this presentation. My why, I want to publish. I understand that. Be transparent with your why when you go work with communities. Make sure it's a win-win-win for everybody. Win for you, win for the institution, win for the community. But what are the benefits of the work, and then how that can lead to partnerships? And you can say, well, Dr. Wilson, I'm struggling with finding a way to get these research questions answered because the community doesn't want to work on the project, right? You have to reorient your work. What you want to do may not be what the community wants to do in some cases. So how to connect what you want to do to what's important in them, what's pocketbook, what's everyday, what's proximal. Food, faith, family, health, and jobs. That's important to a lot of people. So how can you connect either from a primary connection, a secondary connection, maybe you can get away with tertiary connections, coordinary definitely not, because that's people going to see through that. But primary, secondary connection to one of those things. That's the way to build bridges. So when I talk about the 2 hands of engagement, the first hand, issues, impacts, opportunities, benefits, partnerships, and the second hand, food, faith, family, health, and jobs. You can remember those 2 things, these 2 hands, and remember those things. That can help you, when you're trying to navigate and negotiate working with communities, okay? Citizen science, one of my colleagues, y'all may know, Karen Cooper at NC State wrote this book about citizen science. And I think it's an important framework, and she was one of the people who got me on the board of the Citizen Science Association, and I was there. I really brought a DEI perspective to the association. And, traditional citizen science, bird watching, water quality monitoring, I think the power of citizen science is it helps to democratize science. Remember I said earlier, you don't have to have a PhD to be a scientist. It's the love of science, right? So making sure we tap into folks' love of science. We use science we're doing science every day. I'm using science now. We wear science, we eat science, we breathe science, we watch science. Some science we breathe is not good science, right? But we're all applied scientists, whether or not we know it. So help people understand that. I think that's important. And so I just talked about the equity issues. This is a picture of Miss Omega Wilson and Brenda Wilson. Omega and Brenda, who are two of my community mentors that I worked with since I was a grad student at UNC Chapel Hill, starting back in 1998. And their community group is called the West End Revitalization Association. So this is like post-slavery black neighborhoods west of Chapel Hill, North Carolina, because I went to UNC Chapel Hill. They did not have sewer and water infrastructure. So many of you probably heard about Lowndes County, Alabama, Catherine Flowers' work, right? The fact that they're straight piping their waste on the ground. I do a little bit of work in Uniontown, Alabama. When you flush your toilet, your waste goes to the sewage treatment plant. When they flush their toilet, their waste goes to a containment pond. They're spraying human waste on the ground. This is in Alabama, y'all. So in America, I'm gonna say it right, America, right? We have this happening today. People do not have access to sewer water infrastructure. That's a lack of basic amenities. So it's not just a issue in non-U.S. locations. Globally, it's an issue in the U.S. It's an issue in the Deep South. It's an issue for folks who are agricultural workers. It's an issue for folks who live in the colonias. It's an issue for folks who live on reservations. The reason why Navajo Nation struggles so much with COVID-19? Folks don't have running water. How you gonna wash your hands? When CDC said, wash your hands. If you do not have running water, how are you gonna wash your hands to have good hygiene? So this community, they didn't have sewer and water infrastructure. They were gonna have a highway built through the community. So I learned how to do research with communities and working with community scientists as a grad student during my time in Chapel Hill, working with Omega and Miss Brenda. And they came with this framework called the community-owned and managed research approach, where it's equity in funding and parity in management. That equity in funding didn't always work out, but it's about the work being about results and solutions, right? And we came with this term called legal epidemiology. Now, one of my colleagues, Dr. Chris Haney, who's now at Hopkins, we're both grad students when we work with Omega. We also work with Dr. Steve Wing, who some of y'all may know. Dr. Wing's my mentor. He passed, it'll be 7 years with November this year, People's Professor. So we were mentored by both Dr. Wing and Omega at Chapel Hill. And so we came to this approach called legal-based epidemiology, where you study the problem, and some of you who know about environmental health, you have the exposure disease paradigm, you have the source of pollution, you have the emission, you have the concentration, you have the exposure, you have the biological effective dose, and you have the effect. So it has the left side and the right side. We get trapped in causality. I don't want to get into causality game, causality trap. It's all about exposure. If you focus on exposure, if you're not compliant with the law, you can act, right? Are you compliant with building codes? Are you compliant with Title VI, right? So it's about science for compliance. Legal epidemiology may not read well, but science for compliance, y'all can remember that, right? So we came with this whole approach working with Omega and Miss Brenda. And so we were able to get data on sewer and water issues. They had a lot of septic tank failure. They had well water problems. They had levels of contaminants above the MCLs. And this helped to get the bypass delayed. Now, they eventually did build the bypass. Originally, the bypass was going to be built through these historic pre-New Deal black communities. They were able to move the bypass so it didn't destroy the communities completely. That was a win. We also got them first-time installation of sewer and water infrastructure. This is what I did as a grad student. Folks didn't have their roads paved. They didn't have sewer and water. As I said, we still have a lot of folks in this country who do not have access to publicly regulated sewer and water infrastructure, which is the EJ issue. My dissertation was on CAFOs. Just a quick shout out to CAFOs. No, not shout out to CAFOs, but again, my mentor, Dr. Wing. Y'all know about the industrial hog farm issue in North Carolina. So many hogs have been raised, mostly in the eastern hydrophysiologic plain, where, if you look at this map, Dr. Wing came to me, I think it was around 2013, 2014. He's like, Sacoby, I have this idea, I was really excited. I want to map the current distribution of hog farms and map enslaved Africans in North Carolina in 1860. He said, do you think you'll see a pattern? I was like, Dr. Wing, I don't know. But if we do see a pattern, it would really inform my term environmental slavery. Okay? So look at this map. Look at the overlay of folks enslaved in 1860 and the distribution of permitted industrial hog operations in 2014. So you see a spatial relationship there. And it's ecological, right? Could be some ecological fallacy, I know. But you see that spatial relationship. And it just speaks to the point of how racism plays a role in our lives and how it moves across generations from Jim Crow 1.0 to Jim Crow 2.0, and how enslaved Africans in North Carolina, once they resettled, they settled in places where they were still being mistreated. Look at the folks in Mobile, Alabama. Y'all know the Clotilda, right? Y'all know that story. Look, if you don't know the story of the last ship of enslaved Africans, right? Look at the descendants, in the documentary called Descendants, was on Netflix, I believe. You can look it up. And you look at that community, is heavily industrialized. So not only were they, dumped on and dealt with racism post, settlement in that area, they've been basically controlled, right? Used as a dumping ground. They've been basically trapped by pollution, surrounded by hazards. That's also another example of environmental slavery. And then in 1999, Hurricane Floyd hit. So I just showed you all those hog farms. Look at that map. What do you think happened? I don't know. I was just in grad school. Who knows what happened? This is what happened, y'all. Look at all the dead animals. Look at all the floating animals. So Hurricane Katrina hit, right, in 2005. People were wading through a toxic soup of chemicals, right? When this hurricane hit in 1999, people were wading through a toxic soup of animal waste and dead animals to get out of harm's way. So then we had Hurricane Florence, several years later, and so the same thing happens time and time again. So think about these issues of CAFOs and hurricanes and climate change as an EJ issue. Now, I also did work in Charleston. I was at the University of South Carolina before I came to University of Maryland, and worked with the Low Country Alliance for Model Communities. Actually, I still work with them, the Low Country Alliance for Model Communities. So many of you may know the term goods movement. We still have goods coming to the country on ships. You have those goods shipped on rail. Think about East Palestine, Ohio, right? You have intermodal vehicles. You have big trucks that ship the goods, and you don't have the dry ports. You know what the dry port is? Warehouses. Y'all know the huge warehouses that you see. And so that's goods movement. And when we think about goods movement, particularly when we think about ports and the peripheral industries around the ports tend to be in low-income communities and communities of color. So we work to understand these issues to the Charleston area Pollution Prevention Partnership. We call it CAPS. Y'all get it, Cap on Pollution. We try to, I love acronyms. And so we worked on, doing GIS mapping, trying to do air quality monitoring. We found differential sort of burden of various facilities, and LUS stands for leaking underground storage tanks. When you look at race ethnicity in the metropolitan Charleston area, we also measure air pollution at different points near the planned port expansion areas. And the community Union Heights, which was closest to the planned port expansion, it had higher levels of particulate matter compared to other areas that were farther away. Now you would say, well, Dr. Wilson, looking at your slide, those numbers were winning the standard. Just because the PM level, the mean PM level is below the standard, doesn't mean people are not having health effects, okay? That's an industry ploy, and also agency ploy too, where the air is clean. The air is not clean if it's below the standard. It just means you're within the regulatory limit. Doesn't mean people who are living near the highway are not still having health effects. Doesn't mean the people who are low income are not having health effects. Doesn't mean people who are children are not having health effects. Doesn't mean people who have myocardial infarctions or underlying comorbid, talking too fast, don't have health effects, right? It just means that you are within the regulatory limit. There's no safe level of particulate matter, folks. In the same way, there's no safe level of lead, okay? So now they're doing more air quality monitoring. LAMC received one of the EPA air quality monitoring grants. So they're going to expand the air quality monitoring in the area. And we had Project Excellence, was really a way to engage youth and the community around increasing the environmental health literacy. And we did a lot of workshops, and this is some old slides, but we did a lot of workshops with South Carolina D.H.E, helping people learn about monitoring, GIS mapping. This is Dr. David Padgett. Some of y'all may know Dr. Padgett at Tennessee State. He has a lot of this kind of training community members on how to do mapping of hazards. We did soil sampling. So this community not only has issues with the port, they had Superfund sites, brownfields, they had a incinerator, some of the typical hazards you see in the community that's impacted by environmental injustice. So we did some monitoring, soil sampling. We found high levels of various chemicals, including arsenic in the soil. And we created, like I said, we love acronyms, so we created a new community group called CRAB, or C-CRAB. And so the idea is communities should have their own IRB. Because you know our university IRBs are really for individuals, not really meant for communities. So C-CRAB is a Charleston Community Research Action Board. So when any research is going to be done in the community, it has to be reviewed by C-CRAB in that area. So that's another sort of best practice. And then we actually got the incinerator shut down. Now you will say, like, Dr. Wilson, where did the waste go after that? I'm not fully sure about that part of it, just to be honest. But we are trying to do more on the issues of waste management. They try to put a new recycling facility on the old site. And so the idea is the community needs to have more control over land use, planning, and zoning, okay? And then we have a project looking at disasters and disaster resilience in the communities. Let me see how I'm doing on time. I'll need to hurry up. Disaster resilience. And so we're looking at disaster issues, disaster resilience in the Carolinas. We have a project looking at stormwater issues, and we're doing photo voice. So that's another technique for when you're doing communication research. You can do photo voice, you can do video voice. Just want to highlight those real quick. And just looking at how stormwater management, best management practices need to be delivered in a way that are culturally sensitive and engage those communities that are most impacted by stormwater runoff. So think about, again, the issue of urban heat islands. Think about the impervious surfaces. So when you have a heat island issue, it's not just from a heat is not just a problem. Also, because the impervious surfaces, where's that water going when we have rain events? So you want to take a more holistic approach to understand both heat and stormwater in urban heat islands. Okay, so we're doing some work to bring in green infrastructure in Washington D.C. neighborhoods and also in Baltimore neighborhoods, and then we're working in Curtis Bay, Baltimore. This is a community that's again a port community. They have a lot of super polluters. The largest medical waste incinerator in the country. They have a large waste incinerator, a Bresco facility. And here's a picture of the Bresco facility. They also have a CXX coal pile. So the coal pile exploded some months ago because it had methane buildup, okay? So they have all these issues that they're trying to deal with. And then in communities that have environmental justice, you see economic disparities. Look at the median household income of the community, Baybrook area, compared to the rest of Baltimore, the state of Maryland, and the nation. Look at health disparities. So you see these same patterns, folks. So when folks get dumped on, you see economic distress, right? You see health inequities, too. At one point in time, this zip code was the most toxic zip code in the country under T.H.E, toxic release inventory. So Destiny Watford, a student, a high school student, organized her community to stop a new incentive from coming in. So for students in the room and for the faculty in the room, how can we empower your students to actually have impact while they're still students? She was a high school student. She won the Goldman Prize for North America. It's like the Nobel Peace Prize for environmental activism as a high schooler. Powerful. Now, I'm doing a lot of air quality work. I know I'm running low on time, so let me hurry up. Doing a lot of air quality work, because I said I wasn't going to cover every slide. So why am I covering every slide? So one of the things I have some money from Bezos Earth Fund, and we have this data justice collaborative. And the whole thing is we're trying to build out hyperlocal air quality monitoring networks. So for those of you who want to look at climate change, use hyperlocal networks to measure greenhouse gases and those co-pollutants like particulate matter, black carbon, nitrogen, NO2, right? Maybe volatile organic compounds. PM10 as well could be a better indicator of what's happening locally than PM2.5, which seems to be more of a regional pollutant, regional issues. But you have PM, you can measure black carbon. So we're doing this monitoring in Cheverly, Maryland. I'm gonna keep moving forward. We have a monitoring in Prince George's County, a high school. So how can you engage your high school? So it's not just engaging your undergrad students and your grad students, but how can you get K-12 folks engaged too? And getting folks who come from these communities, getting them trained and having them go back out to be part of the fabric of change, right? That's important. So not creating pipelines, we're trying to stop using that term, but pathways for empowerment, pathways of liberation. That's important. And we're doing some work with companies too, like Aclima, this is a commercial, and I'm biased, but the world's leader in mobile-based monitoring. Okay, they use like Google cars to do monitoring, right? Because the monitoring of a regulatory monitor is really not capturing what's happening at the blocks. They do block by block monitoring, and they found 200 to 400% difference in PM levels, right, compared to the EPA standards. So our monitoring is actually not capturing the real footprint of pollution in our communities. So how can you actually affect change, right, and have good decision making if you're using bad data? Bad data in, bad policy out, everybody. So how are we getting focused on that? I'm gonna keep moving. Okay, we're also developing apps. So that's another way to engage communities. Develop apps so they can collect their own data. Again, bringing in community science. We have an app called My Block Counts that's been in progress for about 10 years since I was at South Carolina. We're getting close to being done soon, get it out there, hopefully in the next 6 months. But you can collect data at the block level. We're also developing screening tools. Many of you know US EPA's EJ screen. You know CQ's Climate and Economic Justice Screening Tool. You know the oldest state-level tool is Collin Viral Screen. We developed Maryland EJ Screen. We also developed a park equity mapping tool, okay? These are tools that you can develop that brings in communities' knowledge, that makes sure you have the right indicators, so to make sure that you can ground truth the work you're doing, and use these screening tools to help you identify, prioritize, and micro-target communities for intervention. That's an important point that I want to leave you with when it comes to these screening tools. And we're also building out a climate equity and health mapping tool as well. And so building hubs and coalitions. So a model for you is the Dr. Bull and Dr. Wright's HBCU CBO Gulf Coast Equity Consortium. So that's an important thing that's to note. We have funding from the Robert Johnson Foundation for just funded our hub, the Mid-Atlantic Climate Action Hub. So we're engaging with communities in Delaware, Virginia, DC, Maryland, to really help those build their capacity so they can provide technical assistance to communities in a geographic area concerned when it comes to addressing environmental and climate justice issues. This is a model. The Thriving Communities Technical Assistance Center grants is very similar to this. You have the EPA Grant Makers Grant that I mentioned earlier, the $50 million pass-through. How can you build these hubs with communities? How can you, as Dr. Wright says, Dr. Beverly Wright says, how can you have a community university model? Bring the community into your university and make sure they're driving the work that you're doing. That's part of the innovation, but more important than innovation, that's how you get real impact and have real transformation. And then we're working on our National Academy of Medicine's, they have a grand challenge on climate change, and we're helping them develop their Climate Communities Network. Y'all can look it up, because I went over time into your Q&A, so let me keep going. And just to close, always want to close with Dr. King. Any quote from Dr. King is great. And again, as I said, he's a grandfather of the EJ movement. But again, if you're gonna address these issues, we have to focus on representative justice. We have to focus on the voice of the people, and that has to be an important part of your strategic plan at IBES, at Brown, and all the work that you do in Rhode Island and in the region in general. So thank you for your time, and I will take questions in the last few minutes we have.
Thank you so much for the really dynamic talk. Really, really appreciate it. I'm wondering if you could generally speak to where you think the future of environmental justice research should go. And for some context, we now have 40, 45 years of a ton of data adjudicating all those inequalities that we spoke to. We have a ton of EJ groups that can effortlessly speak to those inequalities and cite reams and reams of data over many decades. You have data up there from 2005 to 2009 in Baltimore, and frankly, I don't know how things have changed in the last 10 years, but we can say that more or less the status quo has been such that data is still fine, whatever, right? And so then what is the purpose or what is your vision for all this data collection for the future of EJ science given that status quo?
Yeah, I think that part of the issue is there's a lot of unknowns with cumulative impacts assessment, cumulative exposure assessment, cumulative risk assessment. So even though I pushed back against the reductionist approach to causality, because I think it's very problematic, you got to prove what exposure led to what disease. Remember, it's not exposure A to the disease B, it's exposure A to disease Z. How do you know? So that's a lot of the federal side, they want to go in that direction to really get that. So I think cumulative impacts is part of it. I think implementation science is somewhere we need to go. Evaluation, policy evaluation, we haven't done a good job of that. So I think when it comes to really getting to the actions and seeing how well they work, and then thinking about the cost benefit, even though cost benefit analysis is problematic for EJ as well, I just want to say that. But I think, and then understanding the benefits. So one of the things like Justice 40 example, the Justice 40 initiative, President Biden's executive order 1468, as it moved from a dirty edge economy to a clean edge economy, 40% of the benefits should go to disadvantaged communities. There's a lot there scientifically across for disciplines, for various federal agencies to see how their programs are working. And how does Justice 40 work for USDA? How does it work for DOE? How does it work at a state agency? So I think there's a lot of scientific needs because a lot of the states, even though, as you said, a lot of communities can cite data, the states are where the rubber meets the road, and a lot of the states are not on board yet. And politically, you may have a state like Maryland. We just passed the Climate Solutions Now Act that has an EJ in it. You can say that I was on the transition team for the Moore Miller campaign. I'm the co-chair of the Climate Environment Subcommittee. That's great. But what about Mississippi? What about Alabama? What about Arkansas? What about the Southern Plains states? They're not there yet. So we got to make sure that science to action, that we can also make things happen in those states, and not just in states that are more friendly to the current regime with the Biden administration, right? And in the states where they're climate denial, people denying climate change, folks that don't believe EJ is an issue, folks believe that we're in a colorblind society. It's a lot more work to be done. Yeah. Thanks for the question, though.
Do you have particular frameworks in mind of how to approach collecting data in a way that you intend to be actionable? Because I feel like a lot of actually the policies, I'm pretty better at policies doing my study, but I feel like a lot of the policies are actually not based on science. So like what you just said, right? Like there is no safe level of PM, there's no safe level of ozone, there's no safe level of lead. We don't breathe 24-hour average air. We breathe every second. So how do we think about making data actionable? And is there frameworks just sort of setting yourself up to be successful?
Yeah, I think science communication is really important. What I like to say is, in the words of a great Star Wars figure, peer-reviewed publications does not science communication make. I think Yoda said that once. He never said it, but you get my point. We got to communicate science in the forms that make sense to the policymakers. They don't care about publications. So I think the science communication is the key. You have to be at the table, right, as a scientist to explain, to translate. I think that is as important as publishing the data, more important. And so, for example, we work with legislators. I just had meetings the last few weeks with the new secretaries of the Energy Administration in the Department of Environment in Maryland. I'm trying to meet with other secretaries. We as scientists have to be at the table to be able to translate the information to them. That, to me, will have more impact than collecting more data, right? Taking data we already have, but getting to them in the forms that they can understand, and also making sure that the qualitative component, contextual experts are also at the table with you. So we have the Mid-Atlantic Justice Coalition, which is made of grassroots groups and advocates that we meet. They're the ones driving our agenda. They're meeting with the secretaries. They're pushing for legislation. That's the way, as a scientist, that I think we have more impact. That's what I'm doing right now. So that's a model that y'all can, do in this state, in this region, is to work with communities and then work direct with the legislators. And then again, remember, no politician goes to politician school. We have to school them, right, on these issues. And I think the science communication is really, really important to increase their literacy on these issues. I think that needs to be a shift in how we operate as scientists to get change to happen.
Thank you so much for the presentation. I'm not trying to strike a binary between community and university, but I'm just wondering, within institutions, do you see other institutional allies for either communities or university communities in this conversation? I'm thinking one in particular. I went to high school and college in Mississippi, and
where in Mississippi?
Jackson.
Oh, you're from Jackson?
I'm not from Jackson. I was born in Baltimore.
Okay, cool.
But
Jackson.
I went to college and high school in
Okay,
Jackson.
cool.
But so I'm wondering, what is the role of the church?
Oh, yeah.
Huge landowner. I mean, historically, clearly, the church had a huge impact in EJ. But I just want to throw that one out there because faith kind of had recurring elements in the presentation. So.
Oh, no, definitely. I said Dr. King, but if you think about the folks, I think I didn't have the slide. Reverend Dr. Benjamin Chavis, right? was a big part of, he coined the term environmental racism in the fight, the PCB landfill fight. But I think the church is a very important part of this. So in my work right now, we have, as part of the Data Justice Collaborative, what we're trying to do is to activate social justice infrastructure that's already in communities. So we're engaging with the AME Church and United Church of Christ in the DC area to basically train folks up to learn about environmental justice, and then we're building hyperlocal air quality monitoring networks, right? And we're bringing in community science. So no, the church is there. The church has to be, so any social justice infrastructure, we should activate it. So part of the activation, also I'm trying to engage historic black fraternities and sororities who have a history of doing this work. I'm an Alpha, if anybody doesn't care about the Alpha Fraternity Incorporated. We also have others, so in NAACP, we're trying to engage them as well. So I think within these different communities, and then just not the black community, other communities, what are those social justice infrastructures that we should be engaging? So faith groups are an important part of that. One of my partners is Central Day Apoya familiar, Wakaria Poole. She's one of my partners on the Mid-Atlantic Climate Action Hub match, and she does a lot of work with faith communities too. So she's trying to engage Latino, Latinx communities through faith with promotores. So we are doing that work. I didn't really highlight it enough, but I think faith and other social justice infrastructures are really important to engage in this work beyond your traditional grassroots EJ group or grassroots community development corporation, other like neighborhood associations that you see on the front line of this work. Thanks for that question.
All right, let's give Sacoby another round of applause. Thank you so much. We're talking actionable stuff here, y'all. I hope you soaked it all in. We're going to try to put it to work. I hope you'll join us for a reception with Dr. Wilson outside right now. And of course, remember the panel at noon over in UEL to hear more about his insights and work. Thank you so much.
Thank you.